Okay, so this is 2 weeks after an L5 stroke S1 lumbar fusion, and we also put a dynamic stabilization at the level above, and here you are. So this was done as day surgery, and can I see you have a little walk? Good, fantastic. And then back that way. Yeah, great. And now what I want you to do is, can I ask you to lean back a little bit more? That's good. That's what I want you to work on. And is
this like a normal stance?
Yeah, no, you're looking good. Yes, absolutely. That's the way to do it. And how much kind of bending? Can you do a little bit of bending?
Well, do I bend my knees? Or
No, just from the back. Just try from the hips. Bend from the hips. That's good. Look at that. Great. And then straight up. Oh, not too much. That's more than enough.
See, that's what I have to watch.
Yes, you have to be careful. Don't do too much, because it's only been 2 weeks.
Below knees, probably.
Yeah, just about there. Yeah, because it's early days. It's only 2 weeks. And the pain's getting better, is it, day by day?
It is, yeah, but I've got other challenges. I think my right hip is probably almost gone, so I'm getting growing pain.
You've got some arthritis.
Problems.
But considering 2 weeks since a major operation, superb.